So we wanted to know, as an Indian and American, how would you distinguish the kind of homophobia promoted in both the cultures?
I definitely do identify as being Indian and American, being born in India and raised in the U.S. since a young age. So I often feel with families that I hope to be that bridge between the cultures, and there are many strengths and challenges in both of those cultures. And I would say that homophobia is concerning in both cultures, and there's a range and diversity in both cultures, right? So there's not really a clear answer to this question. You know, both are based in a heteronormative context, whether it's Radha Krishna or Ken and Barbie, you know, a man and a woman walking down the aisle or walking around a fire. You know, given that the Indian culture, I think, being more collectivistic and family oriented, although, you know, for every family I think of that's Indian, you can also think of an American family also that's similar. So it's, you know, we have to be careful with these broad generalizations. But what I see more in Indian clients is a concern for what family and others will think. The image and family name, bringing shame to the family, is more of a crisis level type concern. You know, even, you know, to the level of marriageability and treatment of extended family, even across the oceans. You know, so the self and what is best for the self is less important, and what's more important is what's best for the family. And actually doing something thinking of the self is considered selfish. And whereas I think in American culture there is more of an emphasis on happiness, on joy, on self-care, self-love. And I think often in our Indian culture that is seen as selfish, and we first our duty and our sacrificing for our family and others is more important. So I would say that then causes an increased level of shame and increased pressure to sacrifice one's own needs and one's own happiness for others. And that can cause really significant feeling torn, feeling conflicted, and having difficulties juggling those two worlds.
So the points that you just mentioned, this is a personal opinion. I think they also extend to other types of phobias that people have in Indian culture. Moving on to the next question. So, in your personal experience and expertise, how can we help reduce homophobic attitudes, behavior, and action?
Such a critical question. You know, my focus as a therapist has been more on supporting LGBTQ plus individuals in coping with homophobia. But with that said, we can be allies and create a protective buffer of support around our LGBTQ friends and family, standing by their side, giving them support, affirmation, and compassion. And at a community level, how we can reduce homophobic attitudes is by challenging the myths and the misconceptions, improving the lack of education and ignorance, and speak up when we see it. You know, be allies, be accomplices in making change. And I think each of us and all of us can do our part in making that happen. So thank you for asking.
Of course, that's so true. To summarize this, what would be your message as a clinical psychologist for the young LGBTQ individuals, and with regards to such societal issues like homophobia and the other kinds like transphobia, etc.?
Sure. Well, I ask to please spread support and kindness, recognize and respect a person's whole self, all of who they are. What we can control is a person feeling loved and accepted. That can truly make a difference in someone's life, you know, and also know that resources are available, and seeking mental health care in your respective areas can really make a difference. I also ask that we let go of stigma and shame. We let go of judgment. And I think whether someone is from the LGBTQ community and identifies as someone who is in their coming out process, you know, or identifies as an ally, a friend, a loved one, a family member, I really do believe that if we can work together, you know, and spread this this recognition, I really believe that we can make change together. So I thank you for doing this work. I thank you for getting these messages out there and letting people know of the resources, and that it is healthy and takes courage. It's so brave to seek help. And I hope that we can really stop not only homophobia, but also mental health stigma. And I do believe that if we work on this together, that we can really make some really important, meaningful change in our communities.
Definitely,
Yeah.
and thank you so much for allowing us to further our cause with all your expertise and insights. We're really grateful, because these are the things that we learn with experience, and as young students who are looking to bring out some change, such a helping hand is really appreciated. So thank you so much.
It has been my pleasure. Thank you so much for having me, and thank you for doing this work. It means a lot.
Dr. Wadhwani, there's just one last thing. Could you educate us a little on the resources available on SAMHIN's website?
Sure. SAMHIN, the South Asian Mental Health Initiative and Network, was founded by Dr. Vasudev Makhija, a fabulous psychiatrist here in the New Jersey area. And we have provided a breadth of resources on the SAMHIN site. Please do check them out. I am a faculty advisor to SAMHIN and do projects like this and advise and write on different issues. I would say our primary mission is to provide education in the South Asian communities and to decrease mental health stigma. So please help us check out our website and resources that are available, and let people know that we are here. We have a range of different support providers that we have advising and taking on different roles at SAMHIN, and we really want to provide a network of support for our South Asian community, and so we are here for you. Thank you so much. Thanks for having us.
Thank you so much, ma'am. Thank you so much.
When it comes to mental illness, we Indians, like other South Asians, tend to deny and pretend that mental illness does not affect us. Mental illness does not discriminate. It affects people from every socioeconomic, cultural, and educational background. We often tend to wait a long time before seeking help, often until the illness is advanced with unpleasant and even tragic consequences. There can be no health without mental health. We should be as concerned about our mental health as our physical health. Remember, accepting mental illness and getting the help is a sign of strength and not weakness. If you're a parent and next time your child in high school or college comes to you and tells you about their anxiety, depression, stress, or the symptoms, please listen and be supportive. Don't trivialize or deny the problem. And above all, do not discourage them from seeking professional help. For more information about mental illness, our programs and services, please visit samhin.org. Thank you.